Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart, Life as a Dad and a 35-year cancer survivor, available on Amazon. Today I want to talk about a particular chemotherapy drug nicknamed the Red Devil. Many cancer patients and survivors know this drug as Adriamycin or also doxorubicin. This particular drug is a very successful and heavily used drug in treating many cancers, as it's known to prevent cancer cells from reproducing, which is important in the treatment for cancer. Many of the cancers treated, obviously, I know all about Hodgkin's lymphoma, but also other lymphomas, breast cancer, bladder cancer, ovarian, lung cancer, and leukemia. And I'm almost positive that some of the things that I'm going to bring up in this video are not discussed with most cancer patients or survivors. Now, before I go any further, I want to remind everybody, as always, I'm not a doctor. I am simply somebody who has gone through cancer treatments, including the Red Devil, Adriamycin. Okay, what I'm hoping to accomplish with this video is to urge diligence in dealing with potential side effects, which are your warning signs that there's a problem with going through the Adriamycin. And the important thing is to understand, Adriamycin is necessary for remission. Okay, that's one of the more successful drugs used in treating cancers and treating many cancers. So it's necessary to use it as long as your body can tolerate it. And it is tough. Okay, I can honestly tell you, I think my chemotherapy that I went through 37 years ago is way more toxic than what's being used today. But that doesn't mean that today's chemotherapy still isn't hard to deal with. Now, when it comes to Adriamycin, side effects occur about 10% of the time, and really that's not a lot. These side effects can include infections, bleeding issues, including bruising, diarrhea, sore mouth, things like that, and of course, one of the most commonly complained about, fatigue. Now, I want to talk about the more serious issue with Adriamycin. And you're going to hear more from me than you probably will have heard from your oncologist, because it's rare that these more serious side effects occur. And I'm talking about cardiotoxicity. Now, break the word down. Cardio, heart, toxic, not good. Okay? So basically, this is damage to the heart. Now, that can be anything from damage of the heart muscle itself to eventually developing congestive heart failure. Okay? And just forewarned, I am a patient dealing with congestive heart failure myself, not because of the Adriamycin, but for other reasons. So there are symptoms if you're dealing with cardiotoxic issues. Okay? And it's important that you pay attention. And it's really hard. And I will tell you, as a cancer patient, I remember what it was like 37 years ago. You feel like crap. So it doesn't really make a lot of sense for you to complain about more. They already know you feel horrible. But the fact of the matter is, they're not looking for this when I say your oncologist is not looking for things to develop. They rely on you telling them symptoms. For instance, shortness of breath, extreme fatigue. Yes, you're already fatigued, but even more. Okay? Heartbeat issues. Okay? Your heartbeat starts doing wonky stuff. Okay? Swelling in your ankles. And this one often doesn't get any kind of attention. Coughing. Okay? Building up fluid inside your chest because your heart isn't pumping like it needs to can produce a coughing issue. Okay? Now, again, this is a rare occurrence when it happens. Okay? How rare? It happens about 1 to 5% of the time. Okay? But it can happen. And if you're one of those unfortunate ones that this does impact, it's important that you let your oncologist know that you're experiencing these symptoms. And I'm going to tell you what to do about it. Okay? Now, I should tell you that the higher risk that you have depends on the dosage. Now, between 3 and 400 mgs/m squared, you've got a 1 to 5% chance of developing this kind of issue. Now, if you go with a higher dose, your chances increase quite a bit. You get up into the 600 and 700 milligram range, and the risk jumps up to like 30%. Okay? But again, your doctor isn't necessarily looking for this stuff unless you tell them you're having these symptoms. And then you tell them that you want this done. Request an echocardiogram. You want your left ventricular ejection fraction tested. Okay? Blood test can help, such as for troponin or BNP or the NT-proBNP. The MUGA scan can also determine heart damage. Okay? Before you start chemo, most patients are put through what I would describe as a baseline test to see where your heart is right now. This is what your heart looks like before we start putting all this stuff in your body. So if you develop any of these kind of symptoms, the shortness of breath, extreme fatigue, heartbeat issues, swelling, coughing, or whatever, and they go and do a follow-up test on this, say after your second treatment, they can tell from this test, okay, if compared to your baseline, if the drug is having a negative impact on the heart, okay? And at that point, they can pause your treatment, they can reduce the dose, or they can even switch to a totally different drug. Perhaps they can even start medicines that can help the heart, okay, go through this. Now, you may be wondering to yourself, well, if they know that this is a possibility and this is what has to be done, why don't they just do this? And I was told by an oncologist, it's not cost effective to do an echocardiogram on every cancer patient getting this drug, to do these echocardiograms every couple of treatments to see if any damage is happening to the heart. It's not cost effective. But it could be the difference with your life, which is why you, as the patient, have to be proactive. Okay, if you're getting Adriamycin, you're developing these extreme cardiac symptoms, shortness of breath, extreme fatigue, heartbeat issues, swelling, coughing, those things. Demand an echocardiogram, okay? Demand blood test, MUGA. Get their attention that you're concerned heart damage from the Adriamycin. They know the potential is there, but they're just not looking for it because it's rare when it happens. But it sucks when you're the person that it's happening to. You have to be proactive. Don't let the words cost effective make the wrong decision for you. Okay? Look, Adriamycin is necessary. It works. Okay? This is how you get to remission. This is how you stay in long-term remission. I'm 36 years in remission. Okay, I'm a 37-year survivor, starting from the point that I was diagnosed. But I'm 36 years in remission. I got my full dose of Adriamycin. I'm not that 1 to 5% who ended up in congestive heart failure because of that drug. Okay, but you need to be diligent. Now, I know that Paul's Heart is followed by many oncologists, other nurses, other doctors, especially cardiologists. Please feel free to comment and add your comments to this video and any recommendations that you have to help cancer patients be more aware and how important these cardiac symptoms are should they develop and what needs to be done. Okay? Worry about the late effects from the drugs. I'm not really that familiar with late side effects from Adriamycin, but I do know very well the short-term side effects that can happen. Okay? Make sure before you start that chemo, you get that baseline done on your heart so that you can have these important comparisons if something should be developed. Again, this sounds scary. It is. Does it happen, everybody? No. It's rare. 1 to 5% rare. But if you're going to be that 1%, this video is going to make the difference for you. Wow. Until next time, this is Paul's Heart.